It is Friday, May the 24th, 2024, and I posted a live rant earlier today. And one of the things that I discussed was the barriers to my own process for finding a provider. And so I decided I would do a video on how and when to research a health provider of any kind, whether that be mental health or your physical health or anything related to health, which would be licensed by the Department of Medicine or the Department of Public Health, or health professionals. And so I want to start with Devesh Patel, who I mentioned in a video that I did earlier this week, which I will link at the end. And the reason that I want to show you how I am researching Dr. Patel is because I otherwise would not have looked any further than to ensure that he has a valid license. But there are lots of other ways to verify whether or not a person has gone through the process of becoming licensed, receiving a provider identification number, which is really the IP, intellectual property taxonomy number, in my opinion. But it's supposed to be more universal than a state license number, and that's the reason why a health professional would have one, and because a lot of insurance panels require that you have one. So that's the third step, is you have, physician or medical professionals who are reimbursed by insurance are not just, you can't just accept insurance. You have to apply to their panels, and then they review your information and then decide whether or not they will allow you to be a provider for their network. So that's why you have in network providers and you have out of network providers in a different cost, because they approve the people that are in their own networks. So with all that being said, the reason why I decided to look into Dr. Patel is because he is a physician for my mother, and he indicated that he had studied under who he called the most well-known or respected doctor in regenerative medicine, who was a professor at Emory. And as I started to look more into that particular professor, because I wanted to know, because Dr. Patel has only recently received his medical degree in 2015. So I wanted to see what the background was for the person who he admired, obviously, and who accredited his own capacity and qualifications too, because he felt strongly that he had learned well from him. So the first thing I'll do is play the audio. I recommend that people record their appointments when it comes to things like this. One, it could be helpful if your doctor has given you, or your provider has given you instructions and you're not sure whether or not you'll remember, or you want to research some of the things that they have recommended, just so that you better understand them, because you can't always have a detailed conversation in the examinations, because they only allow like 15 minutes. So that's one good reason. Then the other is if it's a new provider. And if it's a new provider, I don't automatically rule out anyone, as long as they have the required credentials to practice, and everything else from that point is based upon our relationship and whether or not, what they are doing is working or not. So in this particular case, my mother's treatment is not working, and she is looking into changing that. But because there was some inconsistencies in what he reported during her examination, and his own credentialing, I started to dig deeper. And I'll walk you through how I did that. So you won't always need to do all of this. You want to make sure that they're qualified, but then the rest of it, you have to be able to discern on your own, whether or not they are doing what it is you need them to do. Are they listening to you, so on and so forth. But I'll get into that in a minute. Let me play the audio.
Driveway. You could, your body if this is a non-arthritis, all right, like a tendon tear or muscle tear, right? Muscle tears can heal, tendon tears can heal, right? Arthritis can't heal. That's something that's just the way it is because it's cartilage. It's a non-blood supplied cartilage. So there's no blood supply going to the cartilage to regenerate it. So when you have an injury, your body sends inflammatory markers and all these little cells and stuff that clean up everything and try to heal it down and scar it down. And so I always say, a PRP is essentially like you hire somebody to fix your driveway. Well, your natural body is essentially one jackhammer and two people trying to break down your driveway, get rid of the old concrete, shovel it out, and put down new pavers. A PRP is essentially me saying, here's another 5 extra jackhammers, and here's another 10 extra guys. Get this done sooner than later.
Okay.
Yeah.
So it's like the focus is on the pavement, not on what the pavement is covering.
For the arthritis, it's purely pain control.
I mean, because you just want to fix the pavement. You don't.
We're not fixing anything with arthritis.
They're
just managing my pain.
Yeah, it's purely for pain control. Could there be new research that comes out in the next few years that shows that there might be some cartilage growing back? Possibly, but thus far, there are people that have put a lot of studies out there, and there are people that live by it.
Well, there are some studies, but there are people that have a genuine interest in rejecting information that might lead them to actually looking at the soil underneath the asphalt as opposed to just continuously repairing and replacing asphalt.
Yeah. I trained with one of the leading guys in PRP and bone marrow.
Who's that?
Ken Montner.
Montner?
Yeah, at Emory, yeah.
Oh, at Emory!
Yeah. So they do a lot of regenerative medicine. They do lipogems, they do BMAX, bone marrow aspirations, they do PRP, and they're doing lots of great studies. And they've compared BMAX to PRP, and I'm waiting for the MILE study to come out to see what their study shows. So,
for the PRP
versus bone marrow aspiration to see
okay.
Is it even worth doing a super invasive procedure?
Yeah, I
and
haven't
harvesting stem cells and then spinning and seeing is it better and more effective than not. So they did the double-blind study, and it seems like you have a lot of interest in it. Do you have any experience, exposure, research, or?
Lots of that, but just around her. I don't.
Yeah.
I'm not a doctor, and I don't want to be.
Yeah.
But I do want to make sure that my family is properly cared for and that they're not in pain. And no slight against your training. I'm really impressed with just your knowledge and your capacity to sort of look at all of the different angles. You enlightened for me some other treatments that I hadn't even known about.
Yeah.
But I will look into them.
Yeah.
But I have a particular interest in regenerative medicine because that's what nature does. I mean, nature is regenerative in and of itself. So
go for it. Yeah.
Why did my pain increase?
It's tough to say. I'll be honest. Could you have had a synovitis reaction? Typically, if you have a synovitis where the knee reacts to steroids, within an hour.
All right, instead of, okay, that's enough. So you don't have to listen to any more of that. But I wanted to make sure that you heard the name that he gave. And then a little bit of my back and forth dialogue with Dr. Patel. In general, I liked him as a person. But I can like somebody as a person and not want to use them for the service they provide. I mean, that, the two don't have to be one and the same and can be mutually exclusive of one another. But I want to share with you some information that'll help you to understand when it is important to do the kind of background investigation that I'm about to show you, because it again, it's not necessary to do with every single provider you have, as long as you have a good relationship with them and the reason that you're going to see them in the first place is working, that you are achieving the outcome that you intended when you went to go see whoever it is. As most people know, back in 2022, Deja moved to Elizabeth City, and I was 150% against it because of everything that was going on at the time. She was having medical problems. We were still sort of trying to recover from the COVID quarantine, and she just sprung it on me all of a sudden, and I lost my mind. Ultimately, as a result of that, her medical care got completely away from me, and essentially she got so sick that I really feel like she was on the cusp of some serious medical debilitating medical problems, which I have been able to help her to recover from since that time. It's 2024 now, so it's almost been 2 years. But I still stayed in communication with her, and I tried to do as much research as I could with any information that she would give me about her medical care, because she is an adult. I could not access it on my own, and she would not talk to me, and she would not allow me to attend her appointments with her. So when she called me and told me that she was considering starting this Entyvio, after I researched it, I knew that it was going to make her sick. And but she wouldn't listen to me, and she was she was more interested in whatever the doctors said and whoever else she was listening to at that time. And so I wrote out this journal entry for her in general so that I would have it, because I tend to journal for anybody who might read what I write later. But this particular entry I did specifically for her, and I've sent it to her a couple of times because she did not follow up in the way that I have suggested here. And she was actually put on Entyvio for a year. And Entyvio is a immunosuppressant, which it makes no sense why the medical profession continues to promote any kind of treatments that are designed to suppress the immune system. And I know the reasoning is that, sometimes you may have symptoms in reaction to one kind of treatment they're giving you, like inflammation, and to counter the inflammation, they'll give you something else to block the body's immune response, which is why you're getting the inflammation in the first place. But that is counterintuitive, and anyone who has not lost their natural sense of humanity would say that. They were in their medical training, they would say that makes absolutely no sense why we would do that, especially if your specialty is something like regenerative medicine and regeneration, which there has been extensive research on. I couldn't believe that there was so much scientific research on it, and it's not a standardized way of providing care for everybody. But that's neither here nor there. So what I explained to her is a process that I think is important for anyone who is trying or being convinced that it would be helpful for them to try a treatment that is experimental or that requires long-term treatment. So you have to take it continuously for several months or even years in order for you to see the result. And the reason is because a lot of times when people are diagnosed with like a terminal condition such as cancer, for example, they will automatically take on this mentality that there's nothing else that can be done. And so any kind of medical treatment that I receive is really just to help me to cope, which is true. But, the reason that you have been diagnosed, people often don't think about. In every case where someone has told me that they or a loved one was diagnosed with cancer, I asked, well, how do you know that? And they said, because I went in for this and they did some testing. And then when the test came back, it said I have cancer. I said, well, before you went in, when you told the doctor your symptoms, did they say it could be cancer? Or did they not even realize it was cancer until the testing came back? And sometimes they said the doctors suspected it might be cancer, but other times they would say, well, they didn't think that it was. They thought it might be something else, but ultimately they found out that's what it was. But, I think maybe the doctor just wanted to stay positive or whatever the justification they gave themselves. Deja actually was admitted to the hospital shortly after she had moved, and she had not told me. And the reason she was admitted to the hospital was because she had been home, and I had helped her to detox, and she was doing better. And the only thing that was concerning her is that her feet were still swollen. And I explained to her why her body was still retaining water, but that it ultimately would go away if she continued to detox. But she went to the doctor anyway, just to ask them why I just want to understand why I still have this water retention in my feet. And they did some lab work, which she didn't request. She didn't have any other symptoms. She wasn't in pain. She wasn't, she didn't have fever. She just wanted to know why. She wanted to find out if there was something she should be doing to reduce the swelling in her feet. And they ran some tests and then told her, oh my gosh, your something level is super duper low and you need to go to the hospital right away. So she went to the hospital right away and they put her on an IV and they probably re-injected in her everything that I had just detoxed her from. And she didn't tell me any of this until like a week later. And it wouldn't have even come up if I just hadn't sensed that I needed to call her. And I because she wouldn't talk to me. And so I said, I just want to check on you. And I kind of pressed her because I sensed that there was something. And then she told me, well, I did go to the hospital and was there for, I stayed overnight. And I was like, what? And, why didn't you call me? And she was like, I don't want you to, I can do this myself. And okay, so anyway, this turned into a therapy session. But anyway, so because of that, I knew that she would not listen to me if the medical team was insistent that she needed to have the Entyvio. And so I said, Deja, I need you to do these things to ensure that you are achieving the result that you want from these medical providers because they work for you. They're not doing this for free. And she said, okay. And so I went ahead and I wrote this out for her. And my biggest thing is number 3 down here, where I said, you really need to be able to determine whether or not these people who are working with you are willing to listen to you, or are they just, intent on doing whatever it is they want to do and, trying to make you feel as though, you're being a resistant or non-compliant or, patient because you won't follow through. Because if they're doing a research study on somebody and they're trying to follow and track it, they need for you to follow their instructions. But they're not going to tell you that. And so you have to be able to discern, well, listen, what you're doing is not working. And so I need to know whether or not you're willing to listen to me and to try something different, or are you just going to keep pressing me to continue to do this thing that's not working? I want to make sure I flip to the right page. So anyway, I explained to her that the reason that you want to do this is because it's a good opportunity for you to learn how to self-advocate for your own health. And it will allow you to have the information you need to hold people accountable, because you can look back at your own notes. And I said it because you don't want me to come with you and maybe you're not comfortable with the way I'm going to respond to anything that they're doing. If you just share your journal entries with me, that I can look at them and then kind of give you an idea of what direction to go in next. But because if it's what you want to do and you're going to follow through with it, then I just want to be able to help you to do it in a way that's safe for you and doesn't cause you to get more sick. So I wanted to share these with you to explain why, it took a while for me to get the names of her providers because she wouldn't tell me, because she knew what I was going to do. And had I had them early enough, then I would have done as thorough an investigation as I am now, because there was no reason for them to send her to the emergency. She had no other symptoms. So, if she had not come in, what would have happened? That's kind of my stance on that particular situation. So now, with all that being said, and of course I've spoken over top of these 2 entries long enough that you could pause and read them if you need to, or if you're interested. Let's look at Dr. Patel's mentor, Miss Kenneth. All right, Kenneth Montner is a real person who is at Emory University, who is an adjunct professor at another university outside of Emory. Mercer is also in Georgia. And then it talks about what kinds of professorships and fellowships he offers. Sports medicine, which is, what Dr. Patel studied, is under his purview. And then I just kind of looked at his education because it's important, based on what I'm going to show you about Dr. Patel, whether or not he has worked at any other universities, because it appeared to me that he's only worked at Emory and at Mercer University in the time frame that Dr. Patel would have been studying, because again, he just completed his studies in 2015. So, I kind of use those dates to get a comparison of, just what kind of experience both of them had, whether or not, just because a person has done a lot of research doesn't mean that they have been practicing or teaching that long. So, that's just to give you an idea of how I think or how I look at this information. Okay, then I went to look at Dr. Patel's LinkedIn and his Centera profiles to see what he says himself publicly about his experience. And nothing about the information that I found was surprising, except that we had talked about EVMS and whether or not they had a machine to measure platelets, which I assume they do. I mean, it's a research university. And when I said that to him, he did not mention that he has been serving as a professor there. And clearly it's been since 2021, so it's not a new position for him. But that's neither here nor there. The other thing to note is that he did his fellowship at this Geisinger University, which is in Wilkes-Barre, Pennsylvania. So I don't know how he studied under Dr. Maltner, unless they offered, he does do telehealth appointments in Georgia. So he may have done like a distance teaching, but a distance teaching course in a practical medical field wouldn't cut it for me, because you need to have the person right there with you when you're doing these procedures, and not watching you over a video. That's just my personal preference. And then of course he does mention that he graduated from St. George University, which is it's in the Caribbean, which I'll show you in a second, but I can't remember off the top of my head right now. So neither of these universities seem positionally in places where Dr. Maltner would have had access to him. Dr. Maltner has done a lot of research, going as far back as 2013. That was the first published study that I found that he has done, or research that he has done. But he's done a lot of research since that time. And so, again, I'm just kind of piecing all of these things together to try to figure out where the training came from. Did it come from podcasts and reading research, or did you actually work with this particular physician? Again, he could still be a very good provider. But now that these questions have come up, I have to, and the fact that my mother has still not had the result that she wants from the treatment, I have to look more closely at whether or not I can trust his qualifications, especially given that he is a young physician. It doesn't bother me to work with a young physician or young practitioners. It bothers me if they don't know what they're doing. All right. All right, this is what Dr. Patel, or what Centera has published on their website about Dr. Patel, that his specialty is diagnostic musculoskeletal ultrasound. He does dynamic imaging, which can be significant when you're talking about remote imaging or resonance imaging remotely, which is a thing. So I had to put that in my mind there. He says himself that he can create images of a patient's tissues as they move. So, he translates that for the patient as that's the benefit of using ultrasound to sort of look at and diagnose what's going on and what's causing your pain. But it also says that he specializes in the ultrasound guided injections, which my mother did receive. It says he went to medical school at St. George University in Grenada, West Indies. So that's where it is. And then after completing his family medicine residency, so when he finished his residency, he graduated with a specialty in family medicine and then decided to specialize in sports medicine. It says he did his sports medicine fellowship in Pennsylvania. So again, I'm just wondering how he was able to study so closely under Dr. Maltner during that time. So I went to the university where he graduated from to find out whether or not they had a professor who did teaching or specialization in regenerative medicine, and they do have someone. His name was Mohammed Idris. Here's his photograph and his contact information and what his specialty is. I mean, this is all the information that's available on their website about him. So I can't really speak to what his qualifications are, but he is a professor in regenerative medicine in the West Indies at the school where Dr. Patel attended. And I want to pause for a second and say that just because Dr. Mottner has done a lot of research does not mean that he is a good doctor, which is a conversation that I also had with Dr. Patel during our visit, because it's, doctors who are focused on research are not focused on patient relationships. It's really hard if you have any humanity left in you, or if you chose the field because you genuinely care about people and want to help them to be well, to be a research focused provider, because you have to be able to separate yourself from those patients who are not responding well, because there's never been a research study where they were able to fully cure anybody. If that was true, then no one would be sick in 2024. I mean, they've been doing research in these universities for decades, and they're not interested in finding a cure. They're just interested in trying to keep people alive for the period that they want to be able to use people. That's my opinion, but that's also the truth. All right, the first place that I went was to the Virginia Department of Health Professions license lookup. This is also where you could find my license if you chose to research me, but I put my license number in my LinkedIn profile, so no one would have to go through all of the screens to be able to get to this information. You could go straight to the first screen, put the number in there, and my information would come up. I voluntarily gave up my license in 2019 because I didn't need it anymore. I wasn't interested in doing the work anymore. And you need a license if you want to be able to bill insurance. And that was the reason why I had one. Once I stopped, I didn't need it anymore. I don't know what the process would be for me to get it back, but I don't want to go back to a world where I need it. I have been helping people ever since. I've never stopped because I can't until it's resolved. But anyway, his license did show up. It does show that it will expire in August, but that's not necessarily a big thing. Most people do not renew their license until the month, just like your car inspection. You just know when it's due, and you don't have to. And you have to pay for it. So, I just wait until mine would expire in June every year. I wait until June 1st and I would pay it June 1st. And then I would get my new license, my renewal before the end of the month. And then I would the number stays the same. They just update their information. And I would have to update the insurance panels and all that and let them know that I had renewed, and then they would put the new expiration date on there, and then that would be that. But what was interesting to me about Dr. Patel's license is that it's the only one. Like, I put in Devesh Patel, and he is the only Devesh Patel with a license in Virginia. And the name is not uncommon in especially for Indians, and so for East Indians, and I was like, this is really odd to me that he is the only Devesh Patel in Virginia with a medical license. That I don't understand that. So that it was only for that reason that I went to the Department of Medicine. All right, here's his Board of Medicine profile, the first page of it. I'll scroll through the other two pages, but you can pull it up. But there he is, and there's his Virginia Board of Health Professionals license number, and it says the exact same thing. So, it's all consistent. He is completely legit in terms of his credentialing in the state of Virginia. And, here are the other slides from this particular site. And then you can see all the kind of information that they require that you provide. We the providers have to provide all this stuff. They don't do this research on their own, but they do confirm it because of the insurance panels. And you can see down here at the bottom, the insurance panels as of 2021 that he was approved by, and so therefore he would accept. And then just other information about whether or not he's had any claims or any, if there's been any disciplinary action, things like that, you have to report that every year. Okay, the last thing is the information on his NPI, and the NPI number is different than your license number. But if a provider accepts insurance, they will 99.9% of the time have both an NPI number, which is a national provider identification number, and then their license number, which is by state. So these are his numbers. I have said to myself that this is how the federal government tracks their intellectual property, who are at the level of providing care for their real estate investments. And so they want to be able to track what you're doing and and all that kind of stuff, so they can just plug the number in, and you have you keep that updated. If you don't, I still have an NPI number as well. It's not something that you have to renew. You just update it if anything changes. And the only thing that will prompt you to renew it is if you are changing insurance panels, or if you get dropped from a panel, or if there's a new insurance or something that you want to apply for, and so then you have to update it for that. But that is where the insurance sort of ties into the connection to each individual provider. If it's somebody who you go to have your insurance company help pay for their service. So here's the information from that site. Just to, you can kind of scroll through it, pause, you can go Google it yourself and see. Nothing about what I found here was surprising or, alarming or anything. He's completely legit in terms of all his credentialing and everything. So the question for me would only be whether or not he is good at what he does. So it doesn't really matter if he's had all these degrees and he's got licenses and he's got all of his credentials in order to practice and all of that, if my mother does not improve. So I hope that this has been helpful and educational for people, and it gives you some things to think about in general in terms of being proactive with your own medical care. One of the things that always frustrated me most when I work with families is when people would not listen to their own body. I said, you cannot tell your own body that it is lying to you. Are you in pain or not? Yeah, I'm in pain. I said, well, then you can't, it doesn't matter what the doctor tells you that you shouldn't be or whatever. If you're in pain, you're in pain. So they're not doing this for free. I know you get, it's Medicaid. So in your mind it's free insurance, but it is not free. You are paying for it, whether you know it or not. So either way, even Medicaid has an expectation that providers are able to provide the care that is necessary for you to be healthy, especially women of childbearing age. They are very highly, highly valued, women who are of childbearing age. So, and children. So you need to be able to advocate for yourself, because there are enough people who have toilet paper from these universities and who are practicing and have all their credentials, that if you find someone who is not doing what it is you need them to do, you aren't achieving the result that you want, then you need to ask why. Don't immediately assume that they don't know what they're doing, and see if they'll work with you, and then see if things improve. But then if things continue to improve, or even worse, if it's an abusive provider who just wants to demean you and tell you that you're not sick and you're being dramatic, and things, because there are providers like that, then my thing is, and I said to my mom, I said, listen, it sounds like he's willing to do this and da da da. Do you want to keep him? And she's like, yeah, I want to continue to work with him. I said, okay, that's fine. It's up to her. So if it was me, my first reaction was I'd fire him. But it wasn't because he wasn't a nice person and that he wasn't able to answer the questions. It was because he wasn't able to, my satisfaction, provide information about how to stop her pain or reduce it significantly until he can give her the treatment that he can't give it to her, for several months because of the treatment she's already received. But, what he could do, and we had more answers about how we might address that than he did. So, I think that people need to stop assuming that somebody else needs to understand and know this stuff for you. Only you know your own body. I've taught my children that from when they were children. well, when they were little, when they were young kids, I would listen to them. Does it still hurt? Or, is it still bothering you? Or, whatever, because they needed to be able to advocate for themselves and to say no, in the doctor's appointments. I was, they would ask the questions and I would look at them and I said, you can tell them, yes or no. Does it still hurt, or is it hurting, or, whatever. Because it's their body and they only get one. And I did everything in my power to ensure that they had fully functional adult bodies. I wouldn't even pierce their ears. I left that up to them. I said, it's your body, so I'm not going to pierce your ears. It's up to you if you want holes in your ears. They're not my ears. And so when they decided they wanted to I felt like they were old enough to make that decision. They got their ears pierced. So I just need for you as adults to be able to do the same thing for yourself. And because you are better at doing it for yourself, you'll be better at it for the people who you care about, especially your own children. Thanks for listening.
I am head of triage today and I'm a registered nurse. So I'm going to show you around. Let's go. We have 7 doctors in the house. 2 down there, 1 here, family medicine here, and we have specialty doctors, which are our pediatric doctors. We have our wonderful nursing staff up here taking vitals, and there are EMTs up here as well, also from the United States, and they are taking our blood pressures and the pulses and respiratory rates for everybody. The nurses and the EMTs up front are telling us, do they need to go to surgical? Do they need to see eye? Do they need to see dental? Do they need to see general or pediatrics? And that's where we will send them once they're on this side. So down at the very bottom, we have our surgery waiting area. This is our eye clinic. They are doing anything from eye drops to cataract stuff. And then we're going to move down. This is our lab department. So in our lab department, they're doing anything from pregnancy tests to cholesterol. They're treating pediatrics in there as well. Over here is the theater. In the operating room, they are doing a multitude of surgeries. There's multiple beds in there, and then just curtains, those privacy curtains in between the patients, but it works very well because we can get a lot done in a short amount of time. This is our dental waiting area. So they're waiting out front with us first, and then we send them back here. And these are our wonderful dentists in here. We have our pharmacy, and we'll head on in. So this is our wonderful pharmacy team that is sorting out all the pills for us, right? And then over here is where we are dispensing the medications to the patients.
Over the last 2 days, we are seeing almost 1,300 patients. As of today, we've already distributed over 400 cars, and we're seeing more patients that have long lines that's still waiting to come in to be seen.
Are you ready? Yes, he does peds. They're the lab.
I often wonder what people believe life is like for families and communities outside of a jurisdictional war zone. I also wonder what people believe then happens to those communities and families once the war has been declared over. What is a restoration? What is a reclamation? And what is reunification?
is staying put.
I don't feel like I am trapped. I feel like this is where we're meant to be.
Hamaway's team, working out of a hospital near Rafah, was offered a chance to leave, but with no aid workers coming to replace them, he's choosing to continue working.
We want to be replaced by other doctors, other nurses. We need a whole healthcare system here.
The surgeon was with a group of 10 other American doctors, working with the Palestinian American Medical Association. With limited resources and under the constant threat of a full-scale military invasion, his team has found ways to save lives against all odds.
We are working with rudimentary now instruments. There is minimal medicine to work with, so we're choosing what patients now can get the minimal resources that we have. It's not sufficient to sustain the level of care that many of our patients need.
It's not Hamaway's first time in a war zone. He deployed to Iraq in 2004, where he treated a helicopter pilot who'd been shot down by a rocket-propelled grenade. That pilot, Tammy Duckworth, eventually became a United States Senator.
I'm alive because of Dr. Hamawi and the doctors and health, medical folks who saved me in Iraq.
Duckworth, who credits Hamaway with saving her life, is now pushing American, Israeli, and Egyptian officials to provide the group safe passage out and bring a new team of doctors in.
There's another group of doctors that are waiting to come in with fresh supplies, and so that's what needs to happen.
But she's been given no guarantees. And for Dr. Hamaway, getting himself out isn't enough. He doesn't want to abandon his patients. He's also hoping someone will be there to take his place.
Our hope is that as we leave, we have another fresh team coming in.
What would your message be to Senator Duckworth?
I appreciate her help, and I'm very happy for that day a long time ago that I got to make that connection. But all I could say right now is thank you.
Ryan Nobles.